We'll set up to lie supine. We've already got our lightest band anchored to our foam roller. We'll need to pin it with our feet, lying on our back, supine against a wall, for unilateral overhead pulls with lateral flexion. We'll start with one arm pulling up, palm facing in towards the chest, all the way overhead. Other arm does the same motion, and we side bend towards the side that isn't loaded with the band. Back to center, arms come back down, repeating. Pulling overhead, engaging the lat, which attaches under the armpit, and side bending to engage those external obliques and open up the intercostals on the opposing side. And back to center and down. Pulling overhead. Go at a tempo that allows you to breathe and to breathe consciously, thinking about the engagement of your TVA. So your tailbone is reaching down towards those feet that are dorsiflexed. You've got lumbar extension, so you've got a mouse hole between your floor and the low back. Finish up the last one. And then we'll come to sit up, bracing our abs, switch that roller, pinning it with our feet again, and working on the other side. Unilateral overhead pull into lateral flexion, side bending. Think about your back ribs. How heavy can you imprint them into the floor for this entire exercise? Really work to imprint the mid-back and upper back into the floor. That tailbone, however, is reaching down and away from you. We want the lumbar extension, better pelvic position, since sway back posture is in chronic pelvic flexion. We want to open that low back for more space. Continuing on the breath, bracing the abs to lift overhead, pausing once the arms overhead, inhale, brace the abs to move into that lateral flexion with the back ribs imprinting. Inhale here, opening up the intercostals. Brace, exhale back to center to lower that arm. From here, we're going to come onto our knees for a 3 count, opposite leg extended. Hand is going to come to, the knuckles will come to the forehead opposite hand. And we'll do some torso twisting. Again, opening the intercostals and twisting for the transverse abdominis, contracting that deepest layer of the core. So the leg is in an isometric hold, lifted behind you. And you're going to twist back to center. Exhale, twist. Inhale, center. Taking 3 counts to twist up. 2, 3. Inhale, lower. 2, 3. Exhale, twist. 2, 3. Inhale, lower. 2, 3. Rotations from the rib cage, the pelvis, those bony protrusions of the hips stay square to the floor like headlights. The leg is held isometrically, no movement. The only movement is that rotation of the torso. So really brace your abs, reach the sternum in towards the back body, rotating from the rib cage. Retract your chin, double chin, so that the back of the neck is long. Finish up your last one and go ahead and set up on the other side. Make sure the toes of the knee that's down are tucked on the floor and you're not balancing on the knee. We want some stability and we want to distribute the weight between all 5 metatarsals that are down. Go ahead and begin the work on the other side. We always have one side that's easier than the other. If this is your challenging side, just remember to connect that twist with the breath, the lift of the lower abdominals. Sustain that lift and contraction for the duration of your exhale. The longer you contract your transverse abdominis, the deeper you condition it, and the more you will alleviate that low back pain. Inhale. Pull the abs in towards the spine. Lift up on the muscles that stop your stream of pee as you exhale, twist. Inhale, breathing into the rib cage as you come back down. Pull the abdomen in, lift up on the muscles that stop your stream of pee. Brace those abs, sustain it Exhale, twist it. Retract that chin. Inhale, back to center. From here, we're going to come to lie prone on our abdomen. Now pinning the roller to the wall with that lightest band. The feet pin it as you lie on your stomach, and we'll do a T-pull all the way overhead. The other arm will we'll do the same thing as the arm that's loaded. Make sure the bony protrusions of the hips are anchored to the floor. Your belly button's pulled in towards your spine. As you lift overhead, you brace the abs and exhale. And inhale, back down. Brace the abs and exhale. And inhale, back down. Again, brace your abs and exhale. Inhale to lower. Bracing the abs, exhale. Inhale, lower. Good work. Brace those abs, exhale. Inhale, lower. And from here, we're going to switch sides, setting up on the other side. Make sure the bony protrusions of the hips are anchored to the floor. You're staying aware of the chin being retracted and the shoulders plugged down the back. Rib cage moving in towards the spine. Inhale, prepare. Exhale, brace those abs to bring the arms overhead with the shoulders plugged down the back. It's very easy here to have your rib cage pushing forward, ribs pressing into the floor. Make sure you reach the sternum in towards the back body, plugging the shoulders down the back. As you take the arms up, you brace the abs. As they come back down towards your hips, you inhale. Move on your breath, taking your time. Sternum reaching towards the back body, belly button pulling in towards the spine. Inhale, brace the abs. Exhale. And inhale, brace those abs. And exhale. From here, we'll come to a kneeling psoas stretch. And we'll use this lightest band that's attached for overhead tricep extension with lateral flexion. So we'll take the band, and it'll be in the same arm as the back leg. As you side bend towards your front leg, keeping the pelvis tucked under slightly to open up the hip flexors. Breathe here. Inhale. And on your exhale, you'll give me 3 tricep extensions. You'll pause to inhale, breathing into the side body. Sternum reaching towards the back ribs, abs pulling in and up. And exhale to extend that forearm up and down 3 times. Make sure the bone of your big toe of the foot that's down is really heavy so that the knee isn't rolling out and you aren't rolling out on the foot that's down. Your back toes should be down so the weight isn't all on that knee. Let's go ahead and set up on the other side for our kneeling psoas stretch with overhead tricep extension and lateral flexion. Moving on the breath. Inhale long, exhale to side bend. Give me 3 tricep extensions here. 1, 2, 3, and bring yourself back upright. Inhale, bending the elbow to side bend, staying in the lateral flexion. Exhale, extend. 3, 2, 1, back to center. Inhale, last time, side bending, brace those abs. And extend. 3, 2, and 1, and back up to center. Good job.